18-year-old Umahani Kanchwala is a typical Canadian teenager. She loves her music, her friends, and even her little brother. She balances hobbies, homework, and preparations for her transition from high school to university. And like approximately 90% of all adolescents, she battles acne.
My acne started when I was 14, and it was when I was going through puberty, and it just started going worse and worse every day. Like every time I'd go to school or go to a place, it would be in my face, and I didn't know what to do about it. My friends and family have commented all the time, every time I would go to a family get-together or a function or anything, like a wedding per se, and they would always say, oh, your face, what happened? Is it getting worse? Are you treating it?
Umahani's mom and dad decided to take both her and her brother to see Dr. Manny Raman.
Acne is a very common problem. It affects about 5 million Canadians. It is certainly the most common thing that I see in my practice as a dermatologist. The ratio of presentation of acne in males and females is about 50-50, although males tend to present with a more aggressive form of acne, usually in the teenage years. I would say well over 80% of my patients present between the ages of 15 and 25. It's not unusual for individuals to present in my practice for the first time with acne, however, into their 20s, 30s, or even in their 40s. Not only do I treat acne, but I've also had a lot of personal experience with acne as a teenager. I suffered with relatively significant acne, maybe in some way that has led to my future career as a dermatologist.
Dr. Raman describes acne as a disease which can sometimes be chronic and says some patients require long-term treatment.
Acne is a disease of the oil gland, also known as the sebaceous gland. The reason we develop acne is the contents of the sebaceous gland cannot be released onto the surface properly because it gets plugged at the surface. Once that plugging occurs, the oil gland swells and gets secondarily inflamed, and you develop an acne lesion.
Dr. Raman says patient compliance is paramount to a successful treatment outcome, and that giving his patients appropriate expectations of treatment side effects is a major factor in helping patients stick to their treatment. Umahani couldn't agree more.
He prescribed me acne medicated cream for a nighttime to put on a daily basis.
I think keeping it simple is most important for my patients, specifically my teenagers. If I give them something that they need to use more than once a day, they're just not going to do it. They're going to leave it in the cupboard. So once a day, prescription preparations for acne. I have my patients to be far more compliant with that. It's also important that you use proper skincare, specifically using proper moisturizers and proper cleansers. We want to make sure that the cleansers that we use are not too irritating. We want to make sure that the cleansers remove the oil and dirt from the skin. Specifically, I recommend a Cetaphil Dermacontrol foam wash as a cleanser, and I recommend Cetaphil Dermacontrol moisturizer with SPF 30 as well. Typically, I recommend to my patients that they wash their face in the morning, then apply their prescription products on top, and then wear the moisturizer with sunscreen right on top of that. Then at night, I would ask them to repeat the same process. So again, I recommend wash, medicate, and moisturize twice daily, morning and evening.
Dr. Raman also says the role of caregivers, including both the patient's dermatologist and their parents, is paramount.
When I have my teenage patients come into the office for their acne, I often encourage parents to join them. I think it's important that both teenagers and their parents get into this routine of knowing how to get their acne under control.
I love photography. I'm into fine arts and pop culture. Art just makes me feel happy. I'm looking forward to going to university. I want to be an architect. If I was going to give advice to people who are suffering from acne, I would say, once you start something, don't stop it. Looking back at my acne, my life is amazing now. I'm going confidently wherever I want to without having my face be a problem.
For more information about skincare and acne, go to cetaphil.ca.